Good morning, and thank you for being here. Let's just kind of try to go through a bunch of questions because we have limited time. Does the OMDCP have an official position with respect to the best way to solve domestic meth production problems?
We have a position as far as it has to be holistic. We have to work on getting the message to these young people, particularly at about that 20 or 21 year age limit where oftentimes they begin to be involved with methamphetamine. We know that treatment works for those people that can get back into being productive citizens, and we know enforcement can work, not only working with countries to ban precursors, and I'll be traveling to China in September. Mexico has dismantled a number of laboratories, but they need additional assistance from the United States. And lastly, working with local and domestic law enforcement here in the United States, we've seen some real progress, particularly when I mentioned Mississippi and Oregon.
Okay. And yeah, I would like to talk more about those states as opposed to states that have instituted other point of sale restrictions or tracking systems. What in your experience is working best? Let's take Oregon, Mississippi, compare them to states like Tennessee that has tracking methods. What are you finding? What is your data showing?
Well, the data is showing that the number of lab incidents has been reduced in those two states in which the precursor chemical has been made a prescription only. And you have some experts that behind me that really know their particular state data very, very well. But I would tell you from my law enforcement hat, from many years, law enforcement has had a reduction in resources. And getting more leads and more information isn't quite as important as preventing the problem. And it seems like Oregon and Mississippi show great promise in preventing the problem.
Now, I think initially when Oregon was probably first on board to do that, they did not have the same number of border states. And for example, Tennessee has 7. Now, Mississippi, I think, did have more border states, and they showed similar results.
They've shown a decrease, and I believe the director of the Mississippi narcotics unit is on the next panel. I would tell you that what I've seen in Oregon, in particular in the Portland area, is that it's so easy to cross the bridge into my own state of Washington and purchase the precursors, and that's where oftentimes we see part of the problem. So I think that there is an important part.
Can the same reduction be shown in the states that have more sophisticated tracking systems or electronic log books? Are they showing a decrease, or is it steady or on the incline, or what's happening there?
So the decrease has been in the super labs, the large labs that produce a lot of methamphetamine. The increases in all of these labs, regardless of the state, is in the small use of a pop bottle, the kind of shake and bake method. And so we're seeing that. So we're not seeing that quantity, but we're seeing these numbers. And of course, even when these things are discarded on the highway or in playgrounds or anything else, they cause significant problems. They also drain public safety resources because of the hazardous materials responders that have to come out.
Let me ask this because I don't know the answer, but as a primary care physician for 20 years who has prescribed a lot of cold medicines, well, I know the answer to this. Does Sudafed have any curative factors?
I'm probably not at all qualified to give you that answer, but I know there are plenty of medications for runny noses on the market that don't contain pseudoephedrine.
Okay, what kind of kickback have they gotten in those two states from patients? Has it caused an increase in doctor visits and cost in terms of health care if they cannot get Sudafed over the counter and have to have a prescription?
I'm only familiar with Oregon, and one, it did not increase Medicaid costs. Number two, because it's a Schedule 3, that prescription can be called in. I mean, if you really need it,
right,
that can be sent telephonically to the pharmacy to be filled.
So if I have a patient that I know has severe allergies, runny nose, I don't have to make them come in for a visit. I can call in that prescription or give them a reasonable amount with the refills for 6 months or more, so it doesn't necessarily mean they have to come to the doctor.
I believe so.
Yeah. Okay. I don't have a timer in front of me, Mr. Chairman, so you'll have to, I see I'm on yellow. Quickly on the cleanup portion, you know, a lot of states, including Tennessee, ran out of funds just literally overnight, just flipped a switch, and they were out of funds. Is there anything on the horizon to help these states in terms of dealing with meth cleanup? You talk about the shake and bake bottles being thrown in the ditches, and if they don't have the money to clean them up, I'm not saying law enforcement looks the other way, but these are dangerous chemicals to deal with, and what can we look forward to in terms of help and support in the light of those funds running out?
There is the request in and for funding to replenish, and I think that and it probably is not enough given the number of small labs that are being seized, but there is some additional money there for that.
Okay, and I know my time's expired. We'll talk maybe in the next panel about some of the solutions that I know in Tennessee they went to multi-county storage containers and drastically reduced the cost of the meth cleanup by, gosh, it went from, say, $10,000 to $2,500 for a cleanup with these storage containers. So we'll talk more about that, and thank you, Mr. Chairman. I yield back.